Gone are the days when people believed that you have to be born with a silver spoon to be successful. Today is no longer that era. Today, you don't have to be the son of Mukesh Ambani to be successful. Today, we are living in the world of IT, BT, and the interdisciplinary sciences. And today, we are going to witness one more legend from the biotech and pharma industry. Hey, everybody, welcome to this brand new episode of Legends of Biotech. And today, like I have always said in all my previous episodes, legends are not born and never with a silver spoon. They are born out of their struggles, their circumstances, but they never bow down to the circumstances. Today, I have one such legend from NII. He is the head of vaccine development and his name is Dr. Tanmay Majumdar. Namaskar, sir. Thank you so much for joining us today for this podcast. So I'm really honored to be interviewing you today. I have always been following you through LinkedIn and multiple social media channels. And today, now that I have got this opportunity, let me start by thanking you for all the contributions you have already made to the field of life sciences. And I would like to ask you to share your journey and struggles with our audience before you reach here, please.
All right. So thank you very much for inviting me. It is my great pleasure to be here, to be the platform of Biotecnika. And it is my great privilege that I can share my experience, I can share my journey, how I have reached here, how the immunology is the key partner of health science by which the government of India reached at its peak. I have started about my immunology at the very early age, like at the 12th grade, when my father gave me a medical book to prepare for the joint entrance exam for medical school. After 11, 10, all the parents, they want that their kids to be either an engineer or a doctor. So same passion my father had. And I got a book which is very much fascinating, and it has a lot of information about the immunology, immune cells, their behavior, their function. And learning about I heard the term about the T cells, the B cells, macrophage over there. And those are the things which intrigued me a lot. And then I found that immunology might be more interesting than becoming a clinician, becoming a doctor. So where you have to remember a lot of things. You have to, if you are a clinician, you have to remember the drug name, you have to remember the medicine name, you have to remember the symptoms, disease, lot of memorization, I was not good in memorizing the thing. So and the immunology that sparked me in such a way that the moment I have decided that I should pursue my future in the field of immunology. And immunology is a subject which is a amalgamation of the health science, biomedical science, pure life science, biochemistry, microbiology. So all the things are coming in this field, and they play these are the key partner to build up this subject. So in that way, I would say that was the key which intrigued me to be in this field.
Right. So, Dr. Tanmay, of course, this journey has had a lot of ups and downs. If I have to summarize, all this, of course, has led to the place where you are today as the head at NII. So if you could tell us how does your day look like and what do you do currently while you are leading this team at NII?
Yeah. First, let me give some glimpses of National Institute of Immunology, uh, just which is overall like you can get an idea that what is the institute flagship program and all. This is the first institute in India, where immunology has brought and the study of immunology using the different disease model has been started, like infectious disease model, cancer, autoimmune disease model, reproductive biology. So earlier there was a lot of in 90s there was a problem in the pregnant woman. So NII started to discover the vaccine which can give the support to the pregnant woman. So NII developed India's indigenous leprosy vaccine. The
Wow.
leprosy vaccine, which is still is in the market, which has been discovered by the National Institute of Immunology. So, which has the global acceptance also. Additionally, this institute has played a key role in drug development of the different disease, mainly the vitiligo, the drug which has been discovered and is still is there in market, which is playing an important role to cure the vitiligo. And also in NII has contributed in human genome sequencing, tuberculosis patient genome sequencing. NII is also actively involved in clinical trial of Covaxin, So NII was the major partner of the clinical trial for different vaccines in the COVID time. And these are the things which make substantial contribution of the NII. NII has been involved in the drug therapy, cell-based therapy against the cancer. So with that, I would say that in last 30 years, 3 decades, more than 3 decades, I would say, NII has an impact on the biomedical sites, not only in India as well as in global platform.
Right. So, Dr. Tanmay, I'm really fascinated with all this, and especially that part when you had to go abroad and you were working as a scientist in Cleveland University and that postdoctoral experience. If you could throw some light on the challenges which you faced when you went abroad and you were settling down there.
So, yeah, that is very fascinating journey, So I am from very rural area, I am from the Biotecnika. It's a very fantastic place. The environmental wise very fantastic. At that time we do not internet also. So after doing PhD over there, I got a job, a government job. But after and immediately I got married. Then after that, my wife, I discussed with my wife and I said her that I want to quit this job. So all the his family members, they came and they are saying that why are you leaving a government job? It is very difficult to get in current scenario. But was the main trigger that I left the government job and I pursued my PhD, and followed by I got the opportunity to do the postdoc at Cleveland. And here I saw that there is a lot of opportunity where I can contribute, and that discovery is the major driving force to help me to reach here. And there are a lot of struggle, when you are coming from that background, that lower middle class background, and when you try to enter at the institute where it is a pioneer, the premier institute of India, and there are a lot of struggle and a lot of you have to give a lot of exams, you have to face a lot of interviews, you have to sell your story that what you want to do in next 10 years. Because it's not about that what is your CV is saying. CV, whatever is there, that is done. But what is your in your mind? How you want to contribute to the India? When you want to come back, you have to convince the peers that how you will contribute to the Indian science. What will be your planning? What will be your next 5 years, followed by next 10 years or 20 years planning? So in that way, I try to, might be I am quite successful as I had convinced them, and that's why I got the opportunity to work in the NII.
Wonderful. So I'm sure it was very difficult when we went and you settled, and now it was, of course, a very difficult decision that you have to leave everything in US and then you have to come down to India and contribute towards your own country. Of course, unsettling has its own challenges. But what motivated you to come back and contribute to Indian science? What was your thought process then?
Yeah, see, when we were in US, we were at almost 6 years. I was there, and top of that, when you have a child who is born over there, and for him or her, it's very difficult to come back and settle down here because of the. Even I have seen that my kid is getting very much sick when he landed at India, but you know that that is important person of the life. If you want to get something, you have to leave a lot of opportunities, because you have to prioritize the thing. If you are in US, you might be having the very good health, you might be having the very good lifestyle, but the identity is not there. You have the identity crisis always over there, because you are doing the job for others. Here I am doing the job for me. Here I am doing the job for my country. That is the main driving force.
Right.
That is the main driving force.
Wow.
What you want to do in future? You to be only you having a good lifestyle, big car, big house, or you want to contribute to your country. So that is the major driving force, and that's why today, once upon a time, we have decided that no. Now we have to full stop here. We have to go back. We have to search for the job, and luckily we got the job. It's all about yes, I'm blessed that I got the job. Many people, they do not get the job. That's why they do not want to come back. Even they want, but I got the job, and thus I am here today.
Wow. Exciting journey, Dr. Tanmay. So now I would like to circle back to NII and your current research. So what are the research areas on which you and your team is currently focusing? What are the new challenges of India which you are trying to address through your research?
So you mean what I'm doing now? I just some breakage of the sound. Can you repeat the question?
What are the research areas you're working on currently along with your team?
So what do you do? That is if it is the question, then I can answer that. Basically, I work with the infectious disease model. Okay. So there is one pathogen. It's a parasite, eukaryotic parasite. It's as good as our cell.
Right.
Can you hear me?
Yes, we can hear you.
Yes.
I can hear you.
So there's the pathogen name is Toxoplasma gondii. So Toxoplasma is a parasite, and it is a eukaryotic parasite. Means it has all the organelles whatever we have, except they are unicellular and we are multicellular. They have mitochondria, they have Golgi, they are ER and everything they have. So this Toxoplasma gondii, it infects through our oral route, and after infection, it generally travels to the brain. So its target organ is brain, where it settles down, and it causes the cognitive disorder like dementia, multiple sclerosis-like disorder. It induces, and that's why very much critical pathogen. And you know that there are a lot of different cognitive disorders are there, like Parkinson, Alzheimer, Huntington. There's a different cognitive disorders are there. People are still in a search that why these diseases are happening. So we have shown this is the one pathogen which has a essential role to induce the cognitive disorder. So there is one signaling pathway is there, which is a beta-catenin pathway, and we have shown that how this pathway is being hijacked by this parasite to induce the dementia, cognitive disorder diseases. Okay, so and we showed that the our that we have the important part of our life is that microbiota. Microbiota is not our own organ. It's a pool of microbes, and these microbes is a playing an important role to maintain our immune system. And this microbiota, that's all always microbiota is the second brain of the body, because is this microbiota and microbiota released metabolites plays an important role to maintain body's homeostasis. If
Right.
there is a alteration of microbiota diversity, microbiota frequencies, then you would have the lot of metabolic diseases, you would have the lot of autoimmune diseases. And also, if you have the disbalance of the microbiota, then you would have the cognitive disorder, and also the bacteria, virus will get the opportunity to multiply in your body. Your body will be more susceptible, more vulnerable for the pathogens, and they can make infection easily. You have seen that in COVID-19 time, that in your family, all of them got infection, but few of them are very much asymptomatic. Few
True.
of them are severely symptomatic.
Right.
Why does it happen?
Right.
Because it's all about that microbiota. Because microbiota not only persists in gut, microbiota is there in our lung also. People has a wrong concept that lung is a sterile organ. It is not a sterile organ. It has microbiota also, and this microbiota maintains the lung immune homeostasis. So if you have a good microbiota in your lung, then you are very much resistant to the infection. At least you won't show your symptoms. You do not have much fever, you do not have much cough. But those who are having that disbalance in the microbiota in lung, that might cause the vulnerability of the infection. So that's why you would see the symptomatic patient, asymptomatic patient, and all. So we want to see that how microbiota and metabolites is playing an important role in this cognitive disorder. And by altering this microbiota, can we make a new therapy? So we want to develop a microbiota-based therapy which actually helps to provide the protection against the diseases, because this microbiota can alter our immune cells, so to provide the protective immune cells activation, and that helps to ensure the protection against the diseases. Other than that, this toxoplasma infection is very much critical because it infects to the pregnant woman. So toxoplasma is the only pathogen which can cross two different barriers. One is that placenta. If it infects to the pregnant woman, it can cross the placenta and it infects the fetus. So when it infects the fetus, then it can hamper the brain development. It causes the damage to the developing brain. And that's why when the baby borns, they have the cognitive disorder since they're born. And toxoplasma is the one of the major reason. That's why you are having the defect in the bone. Those are the toxoplasma is the one of the major factor which induces the defect in the cognition.
Right.
So another one is that this parasite also, not along with the placenta, this parasite also can cross the blood-brain barrier, and that's why this toxoplasma settles down at the brain. So we want to understand that how placenta metabolic imbalance disrupt the neuroimmune homeostasis in the. So, like placenta of the mother, where there is a change, when there is a changes of metabolism, how it affects the brain developed neuroimmune homeostasis of the offspring. What is that? Know that the those people who have the job of shifting duty, like in a week 3 days they are working on the daytime, and another 3 days they are working on the night time. They have the problem on this circadian disruption because sometimes they have to act whole day, sometimes they have to act whole night. So because they do not have the rhythmicity of the sleeping cycle, as they lose their sleeping cycle, so there is a disruption of the circadian rhythm that is known as the disruption of the circadian rhythm. And when you have a disruption of the circadian rhythm,
Right.
then your cells is very much vulnerable to get the infection.
Right.
Okay, so those are having the disruption in the circadian rhythm. So though there the pathogens get the opportunity to multiply easily. So we want to understand that how there is a signaling pathway, is there bimal clock, how this signaling pathway is playing an important role in the circadian disruption, and how this affects the T cell differentiation, how it affects the it alters the immune landscape of our body in that way. So we want to understand that how, if we restore the circadian behavior, can we provide the protection against those diseases? So these are the different I just discussed with you who you were work on. And lastly, we want to you that we work also on the reverse vaccine technology. Reverse vaccine technology, what is that? Reverse vaccine technology is the technology where you in silico you map the vaccine.
Right.
Okay, in silico you map the vaccine, then you go to the wet lab, and there you develop the vaccine against particular diseases. So these are the areas where our lab is focusing, and different students are there. So the students have their own area of research, and in those area of research we do work in our laboratory.
Right. That's really interesting, and especially the last part with the reverse vaccine technology. That's something unheard of, and wonderful research happening there. So coming to research now, and you also mentioned COVID-19. So I consider COVID-19 as a 0 mile. So before that, the way research was done, and after that, how research is done is totally changed. So what is your overview or opinion on how research has transformed and how it is being done now compared to prior to COVID-19? What's your observation?
So immunology is the subject where it has the two arms. Okay, one is the therapeutic arm, which is based on the drug development, and another one is the protective prophylactic therapy, where it is about the vaccine. So, can you hear me?
Yes, I can hear you.
So, vaccine is given to the healthy people, healthy subjects. Vaccine is given before the disease. So, if you give the vaccine, there is a protection against the future disease may come up. But the drug is the molecule which is given after the disease. So immunology can take care of the arms. Okay. So if you talk about the COVID-19 and all, so there are important aspects where immunology plays an important role. You know that all the vaccines like mRNA vaccine, DNA vaccines, and they have been developed by different scientists who are specialized in molecular biology, who are specialized in immunology who are specialized in mRNA, DNA, but the efficacy of the vaccine was determined by the subject of immunology, because we have to check whether these vaccines provide the robust memory response against the disease, whether this vaccine can develop a significant protective immunity against the disease. So
Right.
you have to check the different parameters of T cells and B cells, which are the significant factor to tell you that whether the vaccine which you are developed is sufficient to provide the protection against the particular disease. Second thing is that the T cell immunity plays an important role to develop the antibody. We know that the antibody is generally developed is secreted by the B cell, but B cells actually be trained by the T cells. So training is important, and this training of B cells, which releases the antibodies to neutralize the pathogen, actually the training is done by the T cells. So T cells and B cells, they are the amalgamation of these, both the cells are important to provide a successful vaccine.
Right.
Third thing is that the emerging SARS-CoV-2 variants demonstrated that that there are different variants. Alpha, beta, delta, kappa, all the different variants have come up. And so these variants demonstrated that immune escape mechanism. That when the vaccine have been given, even after getting the vaccine, few of them have shown the symptoms, right? So that means the virus has the ability to escape the vaccine protection mechanism, the protective mechanism which we have generated by providing the vaccine. Virus found out the immune escape mechanism. Right. So that's why we have to give the booster doses, booster strategy to maintain the immunity. Right. So these are the couple of these are important factors where immunology plays an important role to develop different types of vaccine, different types of drug, not only against the SARS-CoV-2 but in other diseases also.
Right. So, Dr. Tanmay, that was really insightful. Now, I would like to bring your opinion for our audience. So, you're sitting at the top of the country's top-notch research institute, NII, and you're looking after all this immunological research happening across the world as well as India. So, what's your prediction or what's your opinion how the immunology research and biotech research will be in the next 10 years? That's a decade. What's your opinion on that? Where it is going?
So, I just repeat the question. Maybe there is some, what I understood little bit, they were talking about that how immunology and biotechnology is playing an important role in our country. That's what you were asking?
In the next decade. In the next, what is the future of biotech and immunology research in the next decade?
Yeah. So industry, and let me tell you a couple of things which is important. It is about the immunology as well as biotechnology. Recently, that government of India has given a very much interest as a trust on the startup, for biomanufacturing, these things. So, right. Union Cabinet, a couple of back, chaired by the Prime Minister, Sri Narendra Modi ji, they approved that the Bio E3 policy. So, bio right. means biotechnology. Biotechnology for E3 means economy, environment, and employment. So this is the policy for foster high performance biomanufacturing in Department of Biotechnology. Especially this policy was brainchild of Dr. Rajesh Gokhale, the secretary of the Department of Biotechnology. The salient feature of Bio3 policy includes the innovation-driven support to R&D and entrepreneurship across the thematic sectors. So there is a collaboration between the R&D sectors, like institutes, university, as well as the entrepreneurship, the industrialists, who will generate that. So the discovery will be done by the R&D sections, and the mass scale generation of that drug, that vaccine, will be done by the companies. So these entrepreneurs, the collaboration between R&D and entrepreneurship has been given a significant thrust with the Bio3 policy, and this will accelerate the technology development and commercialization by establishing the biomanufacturing, bio AI hub. You know that government of India has given a special thrust on AI and AI machine learning and the biofoundry. Along with that, prioritization of the regenerative bioeconomy model of green. So this policy will facilitate expansion of India's skilled workforce and provide a surge of job creation, that is the employment. So I believe that Bio3 policy will give will show the route for next 10 years of where we are landing, that will be the one of the greatest biomanufacturing hub of the globe.
Right. Okay. Right. So then that's really insightful, and fingers crossed that should happen. Now, coming on a personal front, you are going into NII every day, doing the research, motivating your team. So what motivates you every day to do whatever you do and continue doing your research? So what's your motivation?
Couple of things I want to tell you. One is that in near future, the new therapy will come out. Other than vaccine, drug, the major therapeutic strategy which will come up is the microbiome-based therapy. Already in different aims, people have started with the fecal delivery for providing the treatment against particular disease. So fecal sample, they are taken from the healthy individuals who have specific microbiota, and that from that microbiota, even you can purify from there, and you can use as a probiotic to provide the protection to cure the disease. So precision microbiota engineering is an important key area where people will develop the bioengineered probiotics, engineered gut bacteria for treating different neurological disease, metabolic disease, immune disorders, and personalized gut flora transplant. This is the personalized gut flora transplant to reverse the aging, reverse the obesity, and to provide the protection against the chronic diseases like diabetes or heart disease, etc.
Wow, amazing.
And this personalized gut flora treatment, gut microbiota treatment with the specific bacteria, where specific bacteria will be more, that will provide a fine tunement of the immune response against autoimmune diseases, against the cancer, against diabetes, against atherosclerosis, against rheumatoid. So different autoimmune diseases, this personalized bacteria population will alter your immune system in such a way that your immune system automatically protection against the particular disease. So in future, this microbiome based is the one of the coming, in the next 10 years you will see that how it will grow up along with the drug and as well as vaccine. Another thing is that the synthetic AI and synthetic biology evolution immunology. So AI has developed an AI drug development, because you know that there are a lot of antibiotics, right?
Right.
But the bacteria, they develop the multiple drug resistance, extreme drug resistance against those drugs. Because they mutate so fast, so the third generation, fourth generation by antibiotics may not be workable against the new variants of the bacterial pathogens. So AI-driven drug discovery has been started that by screening the mutation, they can alter the drug in such a way that new drug can provide the mutated variant protection, provide the protection against the mutant variant where the resistance has been created. And also that the synthetic T cell or NK cell based therapy. Because as I told you that antibiotics generally provide the resistance to the infection bacteria, so people have to cell based therapy. So synthetic T cell based therapy, synthetic NK based therapy, these are the future of the biotechnology, where you can see that there is a lot of prosperity between the R&D as well as entrepreneurship, collaboration, and in that way, India's economy will boost up at a significant level.
Wonderful. So that's really insightful, the way you explain on the future of biotech and immunology in particular, and especially the synthetic personalized medicine and the AI-driven drug discovery. That's really going to explode. In fact, Biotecnika also has a contract research outsourcing arm which is contributing towards AI ML in drug discovery. So I'm happy to inform you that. So, Dr. Tanmay, I think we have reached towards the end of this episode. My question to you is, do you have a message for our young audience of Biotecnika, how they should move forward in their research career?
So I would say that when you are a school student, you should not focus only in engineering or in medical, because we are from the very normal general background, and our parents have the dream that our child either they become a good doctor or they become a good engineer. But world is very big, more than that. In being a student in general biology, being a student on medical biology, being a student on biotechnology, being a student on biochemistry, being a student in microbiology, you would have the lot of potential. Even after being an engineer, lot of people, they do not found themselves to be motivated to do job in company. For them also, this is the field where the physicists come and take a part, the mathematicians come and take a part, the engineers come and take a part, and to provide their knowledge to boost up our subject at a certain level. So this is the where biomedical science is the field where you can see the amalgamation of all the subjects. You do not the biomathematics, biochemistry, biophysics, bioengineering, AI and ML engineering, bio. So these are all the subjects, they come together and they enrich our subject, and that is the future of the biotechnology. And not only that, it's not about that government sector. The private sector has a lot of opportunity, lot of challenges, a lot of prospect, and if you can bring these two partners together, there would be there is the boom of the Indian economy, Indian employment, Indian environment. So that would be my message, that let's do together something good for the help of the country, for the benefit of the country, for the benefit of the biotechnology.
All right.
Thank you.
Thank you so much, Dr. Tanmay. That was really insightful today interacting with you, and I'm sure our audience is enriched. And this is a message from me to all our audience. Like I said always, legends are born out of their struggles. today you witnessed one such legend, Dr. Tanmay Majumdar, who is a proud immunologist, empowering India through his research at NII. And I want you all to also take inspiration from him and become a legend. So thank you so much for watching this episode. I'll see you soon in the next one. Till then, keep shining and keep watching Biotecnika. All the best.